Hi, and welcome to the neurometabolic knee method. In minutes or so, I'm going to share with you the 5 deceptions of chronic knee pain, how to reclaim your freedom and mobility, and also I'm going to share with you what we know will make your knees worse that's being kept secret from you. Then I'm going to share with you the 3 keys on how to fix it. And that way we can have the health we need for the life you want. Now, I'm not only going to be sharing with you my opinion or even just from my 15 years of clinical experience, I'm actually going to share with you the top-tiered, peer-reviewed medical research, what it shows, and I guarantee you it will blow you away. So let's jump in. My name is Dr. Roger Borbon. I'm the founder and clinic director at Pure Life Neurology and Wellness. I'm an author, speaker, and creator of the neurometabolic knee method. My doctorate is in chiropractic, and I have 2 postdoctoral specialty degrees in the field of neurology. I'm board certified as a chiropractic neurologist and board certified as a functional neurologist. Now, in my former life, I was a pole vaulter on the Costa Rican Olympic team and spent years training with 2 of the world's best running and jumping coaches. Now, I only share this with you to illustrate that this method, it's not just textbook theory. This is really an amalgam of 25 years of work, and it combines elite performance with neuroscience and functional medicine. It was created to deliver fast, life-lasting results. So if that's something you are looking forward to, let's move on. So imagine, if you will, that there's a magic pill, and this magic pill will take away part or even all of your chronic knee pain. And once you report these great results of no knee pain to your doctor, that he'll give you a gold star and your insurance will even pay for it. Or better yet, what if your doctor you don't even have to get permission from your doctor? Wouldn't that be great? Well, usually, it's nothing, there's always an exchange, right? So what if the trade-off would be that you experience some symptoms that are kind of like this: vomiting blood, bloody stools, feeling faint, issues that feel like heart or stroke issues like chest pain, trouble breathing, slurred speech, weakness on part or side of the body, and the list just goes on and on. I mean, you would imagine with a list this intense that this is a pretty hardcore pill, right? Well, what is this pill? Aleve. Just plain old Aleve. So you got to think, if this is the list of complications with an over-the-counter drug, what do you think are the results or possibilities with controlled substances that have to be prescribed by your doctor? Well, this is a real concern, and we have some research on this. So out of the journal of the American Journal of Medicine, we know that NSAIDs, which are things like Tylenol, ibuprofen, and the like, those are NSAIDs, or non-steroidal anti-inflammatory drugs, are significantly more deadly than multiple myeloma, cervical cancer, and Hodgkin's lymphoma combined. So you'd be at less risk if you had all 3 of these cancers than taking NSAID drugs for a chronic duration of time for your chronic knee pain. That's just crazy. And the research goes even deeper. This is from the New England Journal of Medicine, probably the most respected journal on the planet. And here we see that NSAIDs account for 16,500 deaths per year. It also accounts for over 100,000 hospitalizations each year from people suffering with gastrointestinal bleeding. This research, if you look into it more, also states that there are no warning signs that the tissue damage is taking place. Well, let me just say it this way. If you're taking any of these over-the-counter drugs or prescription drugs for chronic knee pain, that is your warning sign, okay? So when we look at things like these kind of NSAID drugs, prescription drugs, hyaluronic acid injections, cortisone injections, steroid injections, what do any of those things have to do with a fairy tale of Mary Poppins? Well, it turns out that both are equally effective in resolving or having an effect on chronic knee pain. Well, how would I say that? It's not just dreamed up out of nowhere. This is from the Journal of American Medical Association, and it showed that there was no statistical difference between the two. In fact, it said that the placebo is just as effective as the NSAIDs in dealing with chronic knee pain. So, and chronic pain in general. So, dealing with drugs and even steroid injections, the placebo, which is a sugar pill, is just as effective. So it turns out Mary Poppins knew something. Just a spoonful of sugar would be a whole lot better and would spare you of all those lists of side effects. Of course, we have better ways, but it's pretty crazy when you think about it like that. So then why do we keep doing these things? Because these drugs work, right? Well, we know that Albert Einstein said that insanity is doing the same thing over and over and expecting different results. Well, we just saw research that said really there's no statistical difference between a perception of improvement in taking these drugs and just a placebo. So, but we keep doing these things over and over because, we just don't know there's another option. And then when we look at our healthcare system, it's a system that's in crisis. In fact, when we look at a group like Medicare, who really sets the standards that all other insurance companies follow suit on, straight out of the Medicare guidelines, it says that care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. So yeah, they'll pay for drugs and surgery all day, every day. But let me just decode this a little bit for you in case you weren't familiar with it. Not medically necessary is insurance lingo for we're not going to pay for it. So if it's a drug or a surgery, yeah, there might be some coverage. In fact, oftentimes there is. But if it's an approach that's not fitting in that paradigm, then Medicare won't pay for it. And these are the kind of things that Blue Cross Blue Shield and these other big carriers like to piggyback on so they don't have to be responsible for these kind of procedures. So it just doesn't make any sense. So when we kind of look at this kind of stuff, it makes me think of this time that my in-laws were in town. And so we just got out of church and it was a Sunday and we're heading in to do some lunch all together before they headed back out. And my mother-in-law turns to me and says, "Hey, Ruth saw some of the videos that you have about how you're helping people with all this pain. And she was wondering if you could help her with her pain." Now they live in Dallas, so that's why she was thinking, well, can we do this from afar? And we can usually. So I said, Ruth has been a family friend of my wife's family for 28 years. She's pretty much been an aunt for my wife. So naturally I said, yeah, I'd love to talk to her. We can talk this week. Well, we go inside, place our order, and about 20 minutes later, my father-in-law's phone rings. And you can tell that his, it wasn't good. There was an expression on his face, and he turns to my mother-in-law and says, "Ruth has had a stroke, and she didn't make it. She died in front of her grandchild." So Ruth was in chronic pain, and she was being, her approach of pain was through the drugs and surgery model. And these tools, they aren't made for chronic issues. In fact, these are the tools. There's a time and a place for it. So I'm not anti-medication, not in the least bit. There's a time and place. I have friends who are medical doctors and surgeons, and these are great people who genuinely want to help you. But keep in mind that drugs and surgery are emergency tools. They're to help with, situations like if you have to get your chest cracked open, yeah, you need an operation. If there's a drug that can stand in to help for a life extension situation, then yeah, that's a good thing. So I'm not opposed to that. But my issue is when we're starting to use drugs and surgery that are emergency tools and we start transferring that over into standards of care for chronic conditions because they weren't created for this. And here's Ruth. She should have been coming up into the best years of her life, spending more time with the family, grandkids, and now they're without her. And there's nothing that's going to change that. And I mean, we were behind the curve in this discussion with her, obviously. And that's why I get so heated about this stuff. So you might see I get worked up, but there's good reason. I don't want you to go through this, because I know that as you got on here, you might think, well, this is just knee pain. Well, it's really your life. And these are things that can happen. I can promise you, you only need to experience one of these loss of lives to just take a stand for it. And unfortunately, there's been more than one of those people in my life, and it just doesn't have to happen. It's completely preventable. And that's why we're here tonight. I don't want that kind of result for you, and I don't want your family to be without you, all because of a simple little thing that you might be taking over a period of time that you bought at the store. It's crazy. It doesn't make any sense. And it takes us into what is, our actually number one deception, which is the drugs are working for now. Okay, that's what the doctors thought. That's what Ruth thought, because the report was that, the pain was going down, but then it comes back and it got worse and worse. So don't fall for the chronic knee pain deception that the drugs are working for now, because we saw the research that it actually doesn't. It doesn't even work better than a sugar pill. So number 2 of the chronic knee pain deceptions is that it only and always gets worse. Well, this one's going to be really simple. I'm going to jump over this pretty fast. No, it doesn't. It doesn't always have to get worse. Are these the faces of people that look like they're getting worse? These are my patients. And they have happy faces on, sharing their stories because they're getting better. So, just be careful about who you're listening to. Just because they may be getting worse doesn't mean that you have to get worse. So moving on to number 3 of deceptions is that you're too old. You shouldn't be so active. This one really pushes my buttons, especially when the doctor who says this is so slow that he couldn't catch a cold. We all know people who, as we go up in our years, who have aged and stayed very healthy, very active, very, vitalistic. And there's reasons for that. But, to offset and kind of not own jumping into an approach that could be proactive. Of course, if your only tools are drugs and surgery, that might be an issue, but that's not all there is. So really, if we look at those kind of things and just blame the number of candles on your birthday cake as the culprit, I just think that is the supreme sign of laziness on this doctor's behalf. And a doctor who says those kind of things aren't staying current in the current research, or even keeping in mind that we were created to be very active all the way through our golden years. So, don't fall for the deception that, you just shouldn't be doing that stuff anymore. If other people can be that active, you can too. But we need the right tools to get there. Number 4 is it's just your genetics. You're going to have to learn to live with it. So this is a great one because more and more these days we have more information about the human genome and such things. And there are some great things happening right now. But I have to make a very clear distinction between your genes and that are hardwired and familial traits. So little 9-year-old Sally is in the kitchen with mom and they're making dinner and they have a pork loin. And mom cuts the 2 ends off the pork, throws them down to the disposal, puts the pork in, the veggies, spices it up and all that sort of stuff. And little Sally turns to mom and says, "Hey mom, why do you cut the ends of the meat off and throw it down the trash?" And she goes, "Well, that's how Granny does it." So, and Granny's the best cook in the family, so that's how I learned it watching her. And you know what? I never really thought about that. Why don't we call her and find out? They hop on the phone, talk to Granny, and the mom turns to the daughter afterwards and says, "Well, turns out she just didn't have a big enough Pyrex." So this is just an example of, a familial trait being passed on from generational learning, which is very different from a hardwired genetic disposition. Now, there are some, hardwired genes that do help with creating chronic knee pain. Things like osteogenesis imperfecta, like brittle bone disease, like being bow-legged or knock-kneed. Yeah, those things can help to drive up more inflammation. But even if you are bow-legged, there are, we can optimize things and get better function back. But for the vast majority of us, we have far more control of our outcomes than just what our genetics mandate or dictate. So finally, the fifth deception is knee surgery is a minor procedure. So let's jump into this one. There's really three buckets of knee surgery. There's the first one, which is non-invasive surgery. Then there's invasive surgery. Then there is severely invasive surgery. So let's unpack these things. So the first type of surgery, the non-invasive surgical procedures, which includes the manipulations under anesthesia. This means that there is no cutting of the flesh required. Now, while I am certified and have performed MUAs, anytime you add an anesthesiologist, operating room procedures, we have, one, a lot more expense, and two, added risks. So let's move on to the second bucket. And this is the invasive surgical procedures, which includes arthroscopic surgery, which is also kind of dubbed minimally invasive surgery. These are surgeries designed to help with less scarring and tissue damage. And basically, like you can see in the picture here, avoid a big giant incision into the knee. And these are fantastic surgeries for certain conditions and traumas, dealing with things like, meniscal tears, like the disc of the knee, to ACL tears and other ligaments and repairs. Those work really, really good for those procedures. However, it's interesting because we see in the medical research, this was from the New England Journal of Medicine as well, and it actually aired on the Discovery Health channel one time before it was pulled. And it was a really interesting piece of research that showed that, there are even placebo surgeries. So you had these group of orthopedic surgeons who did a placebo surgery on patients and then also did the actual arthroscopic knee surgery. Now, all this here is basically saying that this is an arthroscopic surgery of, cleaning out the knee. So this is when you have that grinding and that kind of stuff. The doctors are thinking, let's just go in there and clean out some debris. Now, what the research showed was that there was no clinical significance. There was no improvement between the people who had the actual arthroscopic knee surgery and those who had a placebo surgery, which really was just they cut the skin and put a stitch in. Okay, that's what the surgery, placebo surgery was. So there was no difference in these two surgeries. And it kind of mimics the trend that we're seeing in with obstetricians, how they've gotten away from the over prescription or over usage of things like the C-sections, just because more clinical data has come in, and that's what this journal has. So there's the reference for you right there. It's a pretty amazing piece of research. You have to kind of look through the eyes of the medical model. So we have these orthopedic surgeons who are good people and they really want to help, and they have two tools in their tool bag. They have drugs or surgery. So when these surgeons hear these complaints and think, I want to do something about it, well, their tool is surgery. So that's what they want to do. So when they performed this study, they went at it with that kind of approach. But again, we're using the wrong model, or the wrong tools for the job. So let's take this for an example. If there's a car accident and a fireman shows up and he's got the jaws of life and he's got to use that to get into the crumpled up car to get the person out, and the fireman's a hero. That's incredible. The tool's incredible. The whole thing's awesome. Now, just take that same situation, and if the fireman was called to get a cat out of the tree and he used the jaws of life, it'd be a real mess. It's the wrong tool for the job. And it's just like what's being done right now, where we're overusing drugs and surgery that are emergency tools and using them for the wrong situations like chronic pains. Not only that, but these surgeries have very real expenses that aren't placebos. The average cost is $37,125 to $49,500 per knee. That's real money. Now, the deception in this one is that we feel that because insurance is covering a big piece of it, that they're paying for it. The deception versus reality on this is that you've been paying for this all along. Whether Medicare is picking up the bill, you've been paying into Medicare your whole life. If it's your private insurance, you've been paying into that as well. Look, the insurance companies are not charity organizations, right? They are for profit and they know their numbers and they don't like to part with their money, which is your money actually. So this is a lot of money, and that's, just another thing to consider when we're looking at even minimally invasive surgeries. The fifth type of, the third type of surgery is severely invasive surgeries. So these include partial knee reconstruction and total knee replacement. So I guess to start with this, I'd say if you're considering this, I would recommend that you actually look into it. Literally look at it. So go on YouTube or request a video of what is entailed with these surgeries. You might be surprised. It's very eye-opening. And, the other thing to consider with this is that outside of the surgical procedure, there's, downtime that's required, months of painful rehab that's required. And then last consideration is follow-up surgeries in case we don't have the results we want. And then, of course, you get lovely scars like this kind of thing that you get to have for a memento the rest of your life. Now, look, if you haven't explored all your options, especially non-surgical options, I encourage you to do that naturally. And the thing is, once you have a surgery, you can't ever undo it. Okay, so once it's done, and that's all there's to it. Now, this is something that people a lot of times find very shocking, but the morbidity rate of a knee replacement surgery is that 1 out of 400 people die within the first 30 days after knee replacement. Now, the reality is that the high risk zone is 30 to 90 days, but it's very difficult to find the 60-day and 90-day research on this. I'm kind of get the suspicion that after this first 30 days research came in, they stopped pulling data. 1 out of 400 people. If you went to Vegas and knew that you would lose everything in a 1 out of 400 bet on the roulette table, for example, you wouldn't place that bet. So I'm just saying, look into your other options. And again, this isn't just me saying this. This is from the American Academy of Orthopedic Surgeons. Now, we've made it through. Those are the 5 deceptions that I don't want you to fall for because you just don't have to. Okay, but it's not your fault. You're being bombarded with the commonality of these things and the marketing of these things. But now it's time. It's time to, be the oil can to the Tin Man. So, and we can have a lot better results than old Tin Man got. So let's go into the 3 keys for pain-free and active knees. The first key is form. So really it's about the joint plane action and the resulting reformation or maintenance of the shape of the knee. We'll just call it the form for this standpoint. But it has to do with the angles of the knees and the integrity of the tissue of the knees. So that's probably the easiest starting point because, how things are structured is how they're going to help to move. Now, the second factor in the 3 keys is the arthrometabolic function, or just think function. And this just simply refers to the movement of the whole body, but then also to the cellular nutrient flow that's happening. So that we have the movement that we need to drive the form, and that we have the rebuilding raw materials there so that we can maintain good, healthy tissue that takes us for a long lifetime of good use. So that is key number 2. Key number 3 is lifestyle integration. And I know these seem very simple, but these are pretty stealthy things. So here we have a great image that lifestyle includes a lot of pieces. It includes how we move, it includes how we think, it includes our environment, our relationships, our food, our nutrients, our water, our toxicity. So there's a lot of pieces that go into lifestyle integration. And basically the laws that are kind of over all of this are very simple. We have 3 basic laws. So the first one is use it or lose it. So, you could either press snooze all through your life and not get into using it. And if that's the case, then you're going to lose function. Or you can use it. And when you use it, obviously that helps promote, proper motion begets more proper motion. The second aspect is abuse it or lose it. So, there's 2 big pieces to this. There's the more apparent abuse it or lose it, and then there's some stealthier abuse it or lose it. So when we have people like, I just call it the floor installers and the parents with crawlers. So basically being on your knee with compressive force over time, like, people like, in the trades do, or a lot of times parents do, or even religious practices of kneeling for long durations of times on a hard surface, that can really promote some damage of the tissue just from force, and that's an abuse it and lose it situation. Now, more stealthy are things like poor ergonomics and how we hold ourselves. So if you sit with your knee tucked up underneath you, or some crazy position like that, and these are low grade stimuli that over a long time can make a big difference. Or even if you are using poor choice on footwear, even that's very stylish, even like in this picture where she's got her knees all crazy, but then she got these heels on. Heels are not the worst thing, but if you're wearing them all day, every day, yeah, it's going to have an impact and drive up a shearing force in the knee. So those can be a little more stealthy because they are just low grade levels of intensity, but that are done a lot through the day. And probably the biggest stealthy factor is just 1 single pound. Now, clearly, this is not 1 single pound. Now, here's some shocking information for you probably. Every 1 pound that we're over our ideal body weight adds 4 extra pounds of loading force onto our weight-bearing joints. So, and that's in addition to your whole body weight. Okay, so there was some great research done that I will have in the actual free report, the reference of it. But basically, it said for every pound lost moving toward your ideal body weight, offloads the joints by 4,800 pounds of over walking a mile. Just for a frame of reference, this hippo only weighs 4,000 pounds. It's pretty crazy. So that's just the cumulative compressive force over time if we have some stealthy extra compressive force like being overweight. Now, even more stealthy than that is what can happen that looks a lot like this. So we all have heard of insulin, and we know that it has to do with diabetes, and even if you don't have diabetes, you absolutely want to pay attention to this, because insulin is really created to help to shuttle blood sugar so that you can move it into the cell and create energy, or if there's excess, you move it to the fat cells for storage. If we get an unbalanced load of sugars, for example, and then that has a reflexive big outcome or release of insulin, and we keep repeating this over and over again, and this happens a lot with simple sugars, with a lot of breads and things like that, then we can develop what's called insulin resistance. And not to get too much into the weeds, but what will happen with insulin resistance is it creates a cellular response called a cytokine response. And these cytokines end up working just like these termites do on wood. They, one, chew through your joint synovium and joint capsule. So basically that's the connective tissue around the knee. And they also actually will chew on the bone. So if you have a cytokine response going on, then what's going to happen is you can have leakage in your joint capsule. So the synovial fluid or the lubricants of the knee start to leak out. So if you hear your knees when you walk up or down the stairs and you hear this grinding kind of noise, or if you look and there's kind of like pockets in the knees, if you see like pockets of fluid, then you might be having this cytokine response going on. You might have an issue where also these cytokines are chewing through your bone matrix and generating osteoporosis. Okay, so something to consider is if you eat meals and you experience fatigue shortly after eating your meal, this is a telltale sign of insulin resistance, and it's very stealthy, and almost nobody's considering this factor when we're talking about chronic knee pain, but it will affect not only the knee pain that you have, but a lot more than that. You don't want to take that lightly. So this all falls inside of the lifestyle integration issue, and these are pretty stealthy matters that we go through these things that look like this, and we can also do the flip side of lifestyle integration. And the third factor is that which doesn't kill us makes us stronger, right? So these, you've probably seen people from our clinic who've done before and afters, real-time before and afters, just like these here, that gain fantastic range of motion, completely pain-free. Now, again, there's a cost for this, and that cost is, it's not the easiest thing to go through, but I can promise you it's a lot easier than going through chronic pain for the rest of your life. And so if you've ever had some work on your body done that's not the most comfortable, it's a very short period of time, but it gives you a big result, that's part of what we do in the neurometabolic knee method. And you too can have results just like you saw at the beginning of this presentation and the kind of real-time results that we have. So let me ask, the question comes up, can you predict the future of your health? Yeah, can you say, yeah, but I've been like this for years. I don't think that, it's possible for me to get to a new place with this. Well, let me tell you that, yes, you can predict that. So what do we do? How do we get there? So we have to know first what is going on. I need to understand a case presentation or a case history, and I need to understand what your goals are. Not everybody that comes to us is a candidate for this neurologic knee method. So, but we can find out if we are, and moving forward to get results on this just looks like this. We need to sit down together, go through your history, and then find out what your goals are. At that point, then we use a multi-systemic evaluation process. So where I can check out how your muscles, joints, tendons, fascia, how your neurological controls are doing, even looking into things like your metabolism and some things in the lifestyle that might be involved too. And then finally, if that looks like something that I can help, if what we see there, I see an opportunity for getting good results to you, then I can present to you a very clear action plan to correct your dysfunction. And I don't mean over a period of months. In a very short period of time, with most people, even with years of chronic knee pain, we can get fantastic results. But I don't take everybody, because really everybody doesn't qualify. If you don't qualify, I'll tell you. But if you do, then I'll tell you, yeah, I can help you. And it's very, very rare that if I think that I can help you, it's very rare that we don't. And the answers are clear and distinct and actually pretty darn fast. So what then do we do? So at this point, I wanted to share this information with you. One, to not let you fall traps to these deceptions. Two, to show you that the keys to getting out of this chronic knee pain are actually very, very simple. It's just form, function, and lifestyle. Now, yes, there's a lot of details in those three departments. That's for me to take care of for you. So how do we then take the next step? We need to do the complete, neurometabolic knee evaluation. So, like I said, this involves a consultation. We'll look at the different aspects of your form, function, and lifestyle, and I'll come up with a plan of action for you. So, normally our assessment, which would also, we may include X-rays and some neurological tests and orthopedic tests and so forth. All of those things would come out to 287. Now, because you've been on this presentation, I just want to say thank you, because when you get pre-educated, it vastly changes the trajectory that we're on and the understanding that we are. And it's sometimes kind of hard to believe that results like we get are possible. So for taking this time, I want to offer you to take $200 off and do this exact same offer with all the same components for just $87. So that's it. That's all that's required. Now, again, we'll go through all the pieces. That includes our, this is not something that can be done where you come in to the waiting room for an hour and then spend 7 minutes with me. That's not how it works here. I'm actually going to reserve up to a full hour for this time. So we'll go through all those factors in that time. And if you decide to get started, we can have you literally walking out of the office the same day feeling dramatically different, dramatically better. So I look forward to that for you. And, if you, sometimes I have spouses or other family members who have the same issue going on. If you want to be together for that and you want both of you to be looked at, we can just add the second person on for just an additional $47, make it very simple for you both. And finally, let me tell you that it's been a joy to share some of this with you. It's so much fun watching these results for people. So in closing, let me just share a quote from one of our patients, Alyssa. You can see the excitement on her face. So for years, I had terrible knee pain, an 8 out of a 10 intensity. After starting his program, I immediately regained full range of motion with 0 pain. I'm amazed. And when she was, and her 0 was in a big sing-songy voice, she was really excited. And you can be excited too. Thank you so much for this time. We'll see you soon. Bye-bye.